Cavanero.
What is it, Luther?
I've been looking for you. You better talk to that patient of yours, that animal Henry Smith. The next time he comes at me with that wild look in his eyes, patient or no patient, I'm gonna shoot him.
Doctor attacking a patient, really?
I don't have time for this.
You don't have time for it. I just spent the last 20 minutes in physical therapy waiting for him.
He didn't show up this morning?
No, and the next time he has an appointment, he better be there or else. I mean, my time ain't cheap. In fact, if it was up to me, Henry Smith would not be in the hospital. He'd be in a prison.
Come on, a patient is missing and you don't notify security? Your job is to treat him, you know, not to find him. Now, what the hell's going on here?
Did you see the white sheet on Henry Smith?
No, I didn't.
The man hasn't had a good day in his life. No home, no family, nothing, and nobody. The kind of trash you see washed up on the streets every day, but you never stop to look because it makes you too uncomfortable.
I don't know. What, you got too close to your patient again? Lost all objectivity again?
Drop dead. He was never actually in 324? I don't believe it.
What? Patient has vanished, disappeared, being right out of the hospital. Who? Some guy.
Henry Smith.
Big guy, 6'6"?
Yeah.
Yeah, I know where you can find him.
Who filled out the death certificate?
I did.
Well, where is it?
I forgot to turn it in.
You forgot to turn it in. You forgot to turn it in.
I think the autopsy's gonna have to wait a little bit.
Look, I'm going to say this one more time. Indigestion, insomnia, constipation, none of these are emergencies. They can wait until rounds.
I'm not paid to make those judgments, Dr. Cavanero.
Look, I have been up for 36 hours. I was trying to catch a little sleep.
I'm sorry, but that's not my problem.
Nurse Losef, I would like you to give a tap water enema to patients Weingrot, Malian, and O'Connell when they wake up. Also, I would like daily weights and INOs on all my patients. Is that clear?
Mom! If you want to run something through the labs, I get a copy. If you do scans, I get a copy. If you think about doing scans, I get a copy.
Yes, Dr. Cavanero.
Good. What are you trying to pull?
I don't know what you're talking about.
Like hell you don't. What do you call putting me down in front of a patient? Don't you ever question my authority again, lady, or I'll slam the door so hard on you, you won't know what hit you. And when I tell you to do something, you do it. Now, if you've got a problem with that, you take it up with your union or your psychiatrist. But when I say jump, you jump. Did you get that?
May I speak? I don't like you. You're a good doctor, but you're an inadequate woman. I know it. Everybody knows it. You've got a cold heart.
This is about you, and how you could never fathom that you might possibly be wrong.
Can I ask you a question?
Anything?
You seem like an intelligent, decent human being. What makes you do porno movies?
We prefer to call them erotic films, but to answer your question, I was down to my last dollar and sitting in a restaurant eating when a man approached me and asked me if I'd like to be in a movie. He needed someone with an English accent. Adds a touch of class, you know. It's the truth. They quickly discovered that I had a, how shall I say, talent.
I think what you do is immoral.
Yes, I know you do. Have you ever seen one of my pictures?
No?
They're really very funny, you know. Personally, I can't understand why people find them titillating. I suppose that reflects a lacking on their part, wouldn't you say?
You don't seem like a very romantic person to me. Ben, I don't want to feel your head.
Come on, nobody's going to mistake it as a spontaneous gesture of affection. Please, feel my head, please.
All right, all right.
Oh.
Okay. A little warm, maybe a little glowy.
Glowy?
A little. I'm on fire.
Call your mother, Ben. I'm sure she has loads of medicines, cures, spells. The acetaminophen didn't help.
I didn't take it. I can't swallow pills.
What did you do when you were a kid? Live in an incubator? A germ-free adolescence?
Don't make fun. Come on, I'm a sick man.
Oh.
Besides, my mother used to mash up my pills. Eat my Jell-O and my chocolate pudding.
Look, I think you should get rid of this tray, go home, and stay in bed.
And wait for you, right?
You may be the patient, but I am not the cure. Liquids and rest.
You... Well, I have to get up every so often because of, all these fluids it takes. Listen, why don't I call you tomorrow? That is, if I manage to make it through the night. Yes, I know I've lost my sense of humor as well as my health. No, not to worry. Yes. Yes. No. Mom, good night. Why did I call?
This place is disgusting.
You must be the angel of mercy.
Yeah, I must be. If I were human, I'd turn around and leave.
Listen, Barry Doran spoke to me this morning. A girl he was going with had a nervous breakdown. Listen, Annie, all I'm saying is that his work may not have been up to par because he was under a lot of pressure.
Well, it was all self-inflicted.
People make mistakes.
When it comes to being a doctor, there's no room for his kind of mistakes. His exams were sloppy, his orders were haphazard, his attendance at lectures was atrocious. Everybody knows that.
Why'd you have to be such a hard ass?
Let's face it, Wendy, the only reason you're defending Barry is because you slept with him.
Good morning, Doctor.
Barry?
Armstrong told me you're not changing my evaluation, but I wanted to hear it face to face.
The evaluation stands.
You know, getting kicked out of a residency is a pretty high price for a doctor to pay these days.
As far as I'm concerned, you got what you paid for.
Yeah, well, I will now.
But didn't it bother you working on the case?
Sure, it bothered me. Just like working on someone with Guillain-Barré, pneumonia, or hepatitis.
The difference is nobody knows how you get AIDS.
Look, every generation has a disease that freaks them out. Smallpox, polio, TB. The panic is often as big a problem as the disease itself.
Oh, come on, Annie, this is different.
It's kind of a moot point as far as you're concerned, isn't it?
Actually, this is a professional visit. First, I'll be covering for you for a few days while you're laid up.
Wayne, that's sweet of you.
I know. And second, I need to do a complete physical. So if you'll just slip off that nightgown,
Drop dead.
I'm just gonna check your lungs.
Use a stethoscope.
Don't talk, just breathe. Again. And again.
That's enough.
Your chest is in great shape.
You're ordering tests to cover your lechery. Interesting.
Well, one has to be thorough. Now, if you can just give us a urine sample, please.
My right arm's fine, Viscous.
As to reflexes.
They're fine, too. Would you like to see where I can put my knee?
You know, you're starting to sound better already. And you feel good to me, too.
Take your stethoscope and go.
Relax, doctor. Remember, your beeper is in good hands. I'm sorry.
Don't.
Annie, I just said I was sorry.
You arrogant son of a bitch.
Chris, I want you to leave.
Come on, no, you don't.
I don't. Chris, I don't want you touching me right now.
Come on, Annie.
Ah! When I say don't touch me, I mean that.
The thing that really frightens me about these creeps is that they rape again and again, even after a stretch in jail. And they ought to dose them with that new drug. You know, the one they found that blocks the sex drive.
Depo-Provera?
Yeah.
Some of the side effects can be pretty horrendous.
And lowering the testosterone level doesn't automatically stop assaultive behavior. Then they ought to castrate them. Cruel and unusual punishment. I'm all for it.
Don't come near me, Peter. I'll kill you, I swear to God.
Oh!